Hello listeners, on the occasion of Breastfeeding Awareness Month, we have with us expert doctor, Dr. P. Himabindu, MD DGO, Tripura Gastro and Gynae Clinic, Vijayawada. Can you tell us why breastfeeding is considered so important?
So it is really very important for the breastfeeding to be given in the first 6 months of life. It provides essential nutrients and antibodies to the babies, and it also improves the growth and development of the baby. So within 1 hour after birth, there should be a physical contact between the mother and baby, and as early as possible after birth, especially within 1 hour in normal delivery and 6 to 8 hours in cesarean section, we have to start the breastfeeding. It improves the bonding between the mother and baby. Thereby, there will be some skin to skin and eye to eye contact will be present. So it improves the bonding between the mother and baby, and it also has got some other advantages, like it reduces the incidence of breast cancer, and also it reduces the incidence of bleeding after delivery, because it promotes certain special hormones like oxytocin from the anterior pituitary. It will be released, so it will cause involution of the uterus and reduces the bleeding. Thereby, women will not have anemia. So there are so many advantages of breastfeeding.
How could you describe the current breastfeeding scenario in India?
So in India, most of the mothers, especially in lower socioeconomic classes, they will definitely breastfeed the baby. Because I am working in a government hospital, there the breastfeeding is so natural, people start feeding the baby immediately after birth. But the same is not the seen in higher classes. They need some counseling, so that some people will have some fears regarding breastfeeding. If they breastfeed the baby, something will happen like that. So they may have some problem in the later life. These people need to be counseled during the pregnancy period itself. That the advantages of breastfeeding should be told to them, so that they will also get converted and they will try to breastfeed the baby. Actually, there are certain hospitals known as baby-friendly hospitals. So these hospitals, they give antenatal classes to the mother, as well as after birth, they are specially trained nurses who will attach the mother and baby and take up this program. So any hospital can get registered with the government as a baby-friendly hospital.
What are some of the major challenges that mothers face and how can they be addressed?
So challenges means sometimes the breastfeeding will not be sufficient in some cases, especially immediately after birth. There will not be breastfeeding for some people. So they have to be given something like galactogogues, which improve the milk secretion. So there are certain drugs which improve the milk secretion, and also we should promote the mother for the increased intake of good diet. So if they don't take good diet, also breastfeeding will get lessened. And also keeping the baby in contact with the mother. This stimulates the hormones and thereby increases the breastfeeding. So like that, different methods are there to increase the breastfeeding.
What is the initial duration of breastfeeding? For how many months should a baby be breastfed?
Exclusive breastfeeding is advised for first 6 months of life with no prelactal feeds, nothing like water, gripe water. So these are all the myths that gripe water should be given when a baby is having pain. So these are all should not be encouraged. Only mother's milk should be given, not even the animal milk like cow's milk, goat's milk. So mother's milk is very much superior to these things, because the milk should be species specific. So human milk should be given to human baby, not the cow's milk. So this has got antibodies and immunoglobulins, which protects the baby from the respiratory infections and gastrointestinal infections. It improves the intelligence quotient for the baby for the rest of the life. So all these things should be kept in mind. So we have to promote the breastfeeding, exclusive breastfeeding only, no prelactal, postlactal feeds for the first 6 months of life.
Thank you so much, doctor, for your time.